Free EMT Practice Test 2025 Emergency Medical Technician Exam Updated Questions Answers. Question 1. In a mass casualty incident, red tag means deceased, delayed, immediate, minor. Red is for life-threatening but treatable injuries. Question 2. What is the primary function of the diaphragm? Digestion, circulation, respiration, movement. The diaphragm is the main muscle of breathing. Question 3. Where should you check the pulse of an unconscious infant? Radial, carotid, brachial, femoral. The brachial pulse is most accessible and reliable in infants. Question 4. Which of the following is a sign of shock? High blood pressure, slow pulse, pale, cool, clammy skin, warm, dry skin. Hypoperfusion, shock, typically presents with cool/clammy skin and tachycardia. Question 5. What is the first priority at an emergency scene? Patient care, personal safety, communication with dispatch, crowd control. Scene safety and personal protection are always first. Question 6. What is the first step when using an AED? Attach pads, press shock, turn it on, clear the patient. Turning on the device initiates the voice prompts. Question 7. Suctioning in adults should not exceed 5 seconds, 15 seconds, 30 seconds, 1 minute. Limit suction to 15 seconds to prevent hypoxia. Question 8. What is the compression to ventilation ratio for 2 rescuer infant CPR? 30:2, 15:2, 5:1, 10:2. Ratio changes to 15:2 for 2 rescuer pediatrics/infant CPR. Question 9. The prefix HEMA- refers to heart, lungs, blood, liver. Hema means blood. Question 10. A standard precaution in EMS includes gloves, eye protection, gown, all of the above. BSI, body substance isolation, protects the provider. Question 11. Normal adult respiratory rate is 8 to 10 bpm, 12 to 20 bpm, 20 to 30 bpm, 30 to 40 bpm. The standard range for an adult is 12 to 20 breaths per minute. Question 12. A patient in hypoglycemia has high blood sugar, low blood sugar, low blood pressure, low oxygen. Hypo, low glycemia, sugar. Question 13. A patient with a pulse but no breathing should receive CPR, rescue breathing, defibrillation, oxygen only. If there is a pulse, focus on ventilation, 1 breath every 5 to 6 seconds. Question 14. Nitroglycerin is primarily used for high blood sugar, chest pain/angina, seizures, allergic reactions. Nitro dilates coronary arteries to relieve chest pain. Question 15. The correct depth for adult chest compressions is 1 inch. At least 2 inches. 3 inches. 5 inches. Compressions should be at least 2 inches deep for adults. Question 16. Which heart rhythm is shockable by an AED? Asystole. P. Ventricular fibrillation VFib. Normal sinus rhythm. AEDs look for VFib or pulseless VTach. Question 17. What is the anatomical term for front? Posterior. Medial. Anterior. Distal. Anterior is toward the front. Question 18. The in the AVPU scale stands for airway, alert, anxious, apnea. AVPU, alert, verbal, pain, unresponsive. Question 19. The golden hour refers to the time it takes to reach the hospital, the first hour after a critical injury, the time spent on scene, the shift change. Survival rates increase if definitive care is reached within 1 hour. Question 20. A patient with stridor likely has lower airway obstruction, upper airway obstruction, asthma, heart failure. Stridor is a high-pitched sound indicating upper airway issues.